Tonight, I'm going to be talking about a subject that is particularly sensitive. It seems to be very awkward for some people to disclose things about their disease or condition. It can be downright uncomfortable, and it might feel like you're walking on a tightrope. These are all situations that people face with the disease, and caregivers know about them too. Some examples that I've run across just in terms of the myotonic community are a boyfriend asking a girl to a dance, and the girl has MMD, hasn't told anyone, and she's concerned she might fall. What does she say? A college student who wants to give a speech, needs to give a speech in a speech class, and the instructor has asked that these speeches be given standing for maximum impact, and in fact she's not comfortable and is not able to stand for any length of time. What does she say? A boy who has MMD is getting into a serious relationship with a girl. How does he ask about her condition, and what is their future like together? And finally, a person in an interview who is interviewed quite well, and at the end of the interview, the interviewer asks, do you have any medical condition or physical condition that might prevent you from doing this particular job you're interviewing for? Well, so essentially these are all situations where people are put on the spot. I call it walking a tightrope. In discussing how people adapt to these conditions, it's very important to understand that people vary very much in how open they are in general with other people. And there are some people who keep things very, very close to the vest. They're very private, and the psychologists call them essentially this closed personality. You really have to gauge your own self to know where you're starting from. And if you are a person who has greater sensitivity to being open, then the advice in this particular presentation is more significant for you, and may take you more time to really absorb what you want to do. Okay, one more point about openness and privacy. Because myotonic dystrophy is a physical condition, the disease or condition, the physical parts of the condition, may show to others even when you're not fully aware that they are shown. In other words, sometimes people see things that you don't see in yourself, and that essentially puzzles them even more. And finally, a point about telling or not telling. If you tell essentially too much, you could be in a situation where people are taken aback by what you have to say. This is particularly true in the interview situation. I will be talking about that later. If you don't say enough about your condition, you may be taken aback by others. They may question your sincerity or your openness or what you're hiding. So it's, again, a tightrope both ways. To start with, my advice to you, or as a caregiver or the person who has DM, is to know your condition and in terms of what it is you might want to say about it. And I'm talking about the physical manifestations or how you present yourself to others. If you wear AFOs, that's going to be apparent. If you have balance problems, that might be apparent. If you have learning disabilities, that might be apparent. If you have problems with mental focus or sleepiness, that might be apparent. So, but you essentially have to take an inventory of what your physical condition is like before you answer the key question, what do you want to tell others? So it's important to sort of think about what is known by others already and what kind of advice are they seeking from you about your condition. This is a classic slide used in medical conferences. For those of you who are familiar with the blood test that's available to confirm the condition of DM, this essentially is a layout of what the blood test will find. On the left is chromosomes, and on the slightly to the right of that is an area that is marked in purple or blue. Those are where the defects occur, essentially on chromosome 19 or chromosome 3. And then the blood test will indicate the amount of repeats that are in your body and in the cells that are defective. In other words, you should not, a normal person doesn't have very many repeats. And if you have between 40 and 80 repeats, the research indicates you're probably going to end up with a mild condition. It's certainly not going to be very severe. If you have between 100 and 1,000 repeats, then you're probably going to have a moderate condition, and how much symptomatic problems you have is pretty variable, particularly in the middle. If you have like 300, 400, 500. So in other words, you might have a severe condition, you may not. You don't necessarily have to have all the problems now. This is simply a prediction or a prognosis of how many problems you will have as you go through adulthood. If you have between 500 and 2,000 repeats, the likelihood is the symptoms will manifest them in childhood, and again, they are somewhat variable. If you have 1,000 to 5,000 repeats, the likelihood is as a very young child, an infant or a newborn, you will see these symptoms. So just knowing the blood test results will give you some idea of what people will want to know as you go through your life in terms of how many problems you're likely to have and what are the problems. I just want to emphasize, and this comes from taking care of my wife who had MMD and my son who has MMD, talking to many physicians, that if you stay healthy, I'm talking about your general health, if you eat well, if you don't have severe bouts of viral infections and so forth, if you don't fall and break your neck, in other words, if you are absent any real trauma in your life, the likelihood is whatever symptoms you have are likely to be less severe than if you have other health problems. So that's at least one thing you can do to affect the quality of your life. Okay, let's get back to telling about your disease in different situations. I like to present this in terms of the 3 W's. When do you say something? Why do you say something? What do you say? Those questions are critical in terms of you answering the questions for yourself in your particular situation. Now, the last question, how do you say it, is particularly important because that sets the tone and the quality of understanding about what you say to others, and it in and of itself is a skill. But the when, why, and what need to be considered first. If you don't have any symptoms, of course, there's really no need to say anything at that point in your life, even if you've had a blood test and it shows that you were going to have symptoms later. In other words, no reason to tell until something is going on in your life with MMD that causes you to have symptom or many symptoms. Okay, why do you tell also depends on the level of veracity and the level of detail of what you say. If you're talking to an employer, the why is particularly important because they need to know about your safety. If you're talking to a loved one, the why is particularly important because they are connected to you and they really want to know what's going on with you. If you're talking to a boyfriend or a girlfriend and it gets serious, they want to know in terms of joining your life. So there are vested interests on the other side that need to be considered. Okay, now one of the general questions that I've been asked is, what do you say to somebody about DM who is not really a part of your life, but they ask about you? And I generally say that in those situations, say as little as possible. In other words, you don't need to scare people. You don't need to have people nurture you unnecessarily. Something like, and this is what my son said earlier in his life, when he had minimal conditions. He said, I have a muscle disease. It's inherited from one of my parents. It's not something you're going to catch. It's something that I have. My doctors are aware of my condition. They're taking care of me and really watching my muscles carefully, especially my heart. I don't have the same thing as MS, which is also confused with MD. I don't have MS, and this isn't something that is going to go away. I mean, and how much it progresses really depends on how my life gets led and the nature of the genetic condition I inherited. I wouldn't say more than that. And even getting into the detail about the genetics isn't necessary at the beginning with people who are not really a significant part of your life. But there are some situations which are very different from that. There are employment situations, there are work situations, there is relationship situations, and in those situations, we will come back to these things because, as I said, the vested interest that you have and others have becomes much more important. Okay, next slide. Okay, I'm going to share with you a little case study of a person that I knew who had myotonic dystrophy, a young woman, age 20. She had graduated from high school. She had been diagnosed, had the blood test. She has about 300 repeats. She has weakness in her lower legs and in her fingers. In school, she uses an iPad instead of writing, and she's just been fitted for AFOs. Other than that, she doesn't have symptoms. In her second year in college, she decided that she wanted to join a sorority. The question then became, what do I tell the sorority sisters about my medical condition? This question was far more complicated when she realized whatever she told the sorority sisters may in fact affect her dating situations too, if the word got out about her MMD. And she didn't want to tell the sorority sisters much of anything at the beginning while she was rushing the sorority. That's essentially an indoctrination that sorority people go through in terms of whether or not they're going to be accepted into the sorority or invited into the sorority. At any rate, what she did is she went to the president of the sorority. She had a private meeting with the president. She told the president she had a medical condition Her walking required her to use braces that improved her balance too, and she uses the computer and iPad to write. Other than that, she was fine at this stage of her life. The sorority president wanted to know what caused all this, and she said it was caused by a genetic defect that my mother had. The president asked her, well, what do you want me to say to the sorority sisters? And she said, nothing other than the fact that I am pledging the sorority. I can't do some of the physical things for the reason I've described, but other than that, I don't want you to say much. They agreed, and the president said, okay, but once you're in, if you get into the sorority, we're going to have to say a little bit more because people were going to see and know that you have some kind of medical condition. Okay, well, she got into the sorority. She was delighted. She went through the first year there. Not much more was said or even asked about her condition, other than the fact that they knew she had weaknesses in her lower legs and feet. In the third year of school, she had cataract surgery and she was beginning to have some more balance problems. At this point, she went to the president again and said, I think it's time we say something to the sorority sisters. Now, the dilemma is I don't want the sorority sisters, said this woman, to say things publicly because if they get out and I go to a sorority party with boys, I don't want to have all the boys know that I have this condition at this point. When I get serious with the boy, that's another story. So all the sorority sisters met together in a pledge, and secrecy is very important in the sororities, and they agreed they would keep this information confidential and only in the sorority, and they did. She then did give them a brief brochure on myotonic dystrophy and answered their questions and no more. And she assured the sorority sisters that her condition will probably last a lifetime, and during the later stage of life, she might have more problems. But right now, she's certainly able and willing to do everything she can for the sorority. Okay, that's the way her college life ended. Okay, but my point being, how much you say really depends on who you're saying it to, what the sensitivities of the situation are, and very much is related to how it is you present yourself to others, because you really need their trust and support. When you decide to tell about your DM, my suggestion is you go through a period of rehearsal. Now, I don't necessarily mean what this slide says, which means you get in front of a camera or a mirror and just talk to yourself. But I do mean you will do some rehearsal. For example, with my son, Terry, I would rehearse with him in the car, just in a game-like situation, tough questions in an interview that he would have to answer. And I pepper him with questions. We'd have a good time doing this. And in fact, in his case, he was very successful in interviewing in Florida. He interviewed with about 6 companies. He got 5 job offers. And then he had to decide which one he was going to take. That's another story. But at any rate, he was prepared, and he knew the kinds of questions that professionals would ask. But if you're in a relationship situation and you just need to think it out loud, mental rehearsal will work fine. It's often used in acting anyway. People mentally rehearse and visualize what it is they're going to say. The important point in rehearsal, no matter how you do it, is you get prepared and keep in mind that the art of telling requires you to use the right tone and feeling for the situation. Okay, now I'm going to give you some examples as we go along about this. Let's go to the next slide on dating relationships. Okay, this is one of the areas I want to emphasize. First of all, if you're going to say something to a prospective boyfriend that's getting serious, when is very important. The when of the 3 W's. When do you want to say something? Choose the setting carefully. It should be a private setting. It should be when you can give undivided attention to each other. It should be told gradually at the beginning of the relationship. You might say a little bit about your weaknesses, not much more unless asked. In the dating relationships, people don't generally ask too much. As the relationship increases in its intimacy and you're getting real serious, then it's ready, you're ready for the no surprise discussion about the nature of the disease. My suggestion is when you do this really depends on your feelings, so let your feelings be your guide. And in the big time discussion later about DM, you want to make sure you ask your partner for help and understanding and patience. The most sensitive parts of the discussion are going to be about the future of your life together and children, especially if marriage is around the corner, or a live-in relationship that's very serious. And then you really have to go through all the genetics, preferably with a genetic counselor. But if it's important to say how you feel about having children, what to do about that. And there are things you can do. You can adopt children. There are other things you can do, but they get expensive and certainly require a genetic counselor and physician involved. At any rate, my point is make it gradual at the beginning. Make it a sit down. Have your help you, and near the end, even attend an MDF conference or attend a physician meeting with you. Okay, enough said on dating. Onward to the job interview. Okay, this is an area where I have a lot of experience as an interviewer, as well as assisting other interviewers interviewing people with and without disabilities. Okay, I just want to emphasize again the importance of rehearsal in the interview situations to get past anxiety. By the way, hypnosis, believe it or not, has proven to be helpful to people who get very anxious in interview situations too. Other relaxation techniques include deep breathing. They will definitely reduce the amount of anxiety you would feel, at least physically. And essentially, just remember to breathe. People get so busy in interview as attending to the interviewer and their situations that they just crumble. So it's important to relax and take deep breaths along the way, even between interview questions. Now, I'm going to give you some tips on how to succeed in an interview with your disability on the next slide. Okay, these tips help people with or without a disability. The first one, think of yourself as a product to sell. The interviewer is trying to judge whether or not you are going to add value to the company. So you really have to step back and say, what value do I bring to the company? That's different than most people who are going to be interviewing. Remember, if you have a disability and if it gets discussed in any way, to make real strong points, you have to make them in this period about what you can do on the plus side to bring productivity, performance, creativity to the work situation. So step back and ask yourself, even write them down. What are your critical assets. And don't be general, like I'm good with people. Be very specific. I am very good helping people problem solve, and this is the way I do it. Okay? Be very specific. The second thing to be done in an interview is to allow yourself to tell a couple of stories, particularly when you've been effective in the past. So if an interviewer asks you a question, such as, how do you handle people who are difficult to get along with? And so you can answer that question generally or specifically. The best answer is a story. If you can say, well, let me tell you about this situation in which I was in school, work, community situation where I had to deal with a very, very difficult situation. In fact, here's one that my son Terry faced. When he did volunteer work before he started working in a full-time job, he was working as a volunteer in a major hospital, and several of the other volunteers were very uncomfortable with him because he was a young person and he had a disability, and they didn't feel comfortable with him. They didn't feel as if he belonged. And so he would take, for example, he would take the interview question and say, well, in this situation, I did these things to be accepted by the older people there. And he very specifically told how he would make friends with these people, how he would allow them to get to know him, how that he would share things that he'd done in his life that would indicate that he could be mature beyond his years. So you can get these stories across in the interview. They make an incredible picture in the interview for an interviewer. And we've actually taught people who are interviewers to look for these stars, things in which people excel in very specific ways. Okay, the third one is particularly relevant for people with disabilities. Be prepared to turn negatives to positives. For example, an interviewer asks you a question in an interview. Well, you need more sleep than most people, and you've told us that we need to give you some breaks and so forth. How can we be assured that you are going to be attentive the rest of the day? Okay, that's the question. The answer to the question is something like this. I have taken various steps to improve my alertness and focus in discussions with my physician. I'm on a medication to stay alert, and I've been very, very successful with doing that. When I work, I particularly am focused more than the average person on what am I doing in order to be safe and specific and to produce the result on time. And thirdly, I've actually used a timer in some situations to make sure I don't doze off in areas where I know I'm sleepier, or I take just a cup of coffee or something to give me a caffeine boost if I need it. So in other words, turning these situations around in terms of, well, I've done these things to address what you're asking me. Bring visuals to an interview. People often forget that to bring recommendations, evidence of their work products in the past, even artistic books and pictures if they're involved in that, so that the interviewer knows about the quality of their work, not just in what they say, but what they've done. And then lastly, is very important, particularly in terms of overcoming your fears in the interview, that you visualize yourself as the successful candidate. In other words, instead of thinking of yourself as a person with a disability that wears the disability on his or her back, it's very important that you turn it around and you think of yourself as the successful candidate going into that job, doing it successfully, and performing. Visualization, which is what the psychologists community call this, is an incredibly um, effective way of having you rise to the top, so to speak. Because if you can visualize yourself that way, you're going to have a better chance of giving yourself permission to act that way, both in the interview and on the job. So visualize yourself. That, by the way, is used in professional baseball by sports psychologists to teach sports people how it is to overcome their fears and batting and so etc. All right, work settings. Now you got the job. You've hired. Actually, the battle is far from over. In some ways, it's just starting. Because now you're in a myotonic situation where perhaps your disease is progressing. Safety might be a consideration. Your peers are beginning to ask questions. They want to help you, but they can't do the work for you. And you need to step back, take another read about your diagnosis, the conditions you're having. If necessary, you really do need to talk to your boss. Better to talk to your boss earlier than later. If you hide your condition and then talk to your boss, it violates the principle at the beginning of this presentation. Holding back too much could be very costly. So if you talk to them early, he can help you solve the problem early. One of the things I tell people in work settings is employers need to provide, quote, reasonable accommodations. Now that is a very vague definition, and employers interpret that differently. But I'll give you an example that my son used. He worked in the warehouse, and his balance was beginning to give him some problems. And well, the warehouse people knew he had a medical condition. They were beginning to see that he was having difficulty with walking, which is of concern in the warehouse. Whether he used a scooter or not, he couldn't be in it all the time because he had to go get parts and things of this nature. So what he did was he talked to his physical therapist, who he was seeing at the time, and the therapist wrote a recommendation to the supervisor. And the therapist said that if you could provide a cart so that he can wheel the parts around, he can use the cart at the same time to help him balance himself in the warehouse, which would also be a safety consideration. So, and they did that, and essentially the cart became known as Terry's cart in the warehouse. So that's a scenario that worked for Terry because he was essentially problem-solving his own problem and really doing something about reasonable accommodation without calling or insisting on calling it that. This is going to sound like I'm bragging, but in Terry's case, let's go back to him when he worked in the warehouse. What we did eventually, well, we wrote a book together, Terry and I, about living with a lifelong disability, which covered many of his experiences. And I offered some advice to young people. But at any rate, that book ended up at his warehouse. And what the employer decided to do was to put him on a newsletter featuring his book. So it actually, what happened was he then became known by a large part of the company that had never even known of him, which increased his credibility and as a person with a disability who had essentially done something positive. And so, in other words, and the employer was a very community-based employer, so we were fortunate in this instance. So, I mean, it's things like that, you know, in terms of, well, what do you say? When do you say it? By the time we were sharing, or Terry was sharing things about his book, I mean, people already knew he had the cart and all this was going on, and he was fine with it, and they were fine with it too. And I'll be glad to answer more questions about work situations and relationship situations. Well, all of these scenarios, every one of them comes down to how can you be accepted with your disability, and behind it is always a fear of rejection. Rejection is a very common fear. The advice I've given you all along will make it easier for you. Basically, if you end up in scenarios where you practice and you communicate and talk to people about what it is you want from them, you're going to do better, particularly the employment situations. You'll do far better than just imploding. Short of that, I would advise you, if you really get super anxious, there's medication available for anxiety. There's also hypnosis. There is progressive relaxation techniques. All of these are meant to help you get over the possibility of rejection. As I've told my son many times and my wife, no one situation in life is really that critical. There will be others. So if you don't succeed, try again and again and again. Just don't give up. The art of persistence is very telling in terms of overcoming rejection. Well, then I think I'm going to stop right now because it's really important to hear from the audience.
Okay. So you want me to...
You open up the poll.
Okay. Here's a question. How do you discuss mental deficits to family and friends of an adult child? Sometimes I feel people are judging him unfairly because they don't understand that he has a medical condition.
Okay. Repeat the question one more time.
How do you discuss the mental deficits of an adult child with DM?
All right, that's okay. Say no more. The mental deficits, well, first of all, you really have to know how serious are the deficits. If you're talking about learning disabilities, which many young adults have, in fact, I'd say more than half the people I work with, maybe even 2/3 of them, have learning disabilities. That's one thing. If you're talking about more serious deficits that involve mental retardation, that's another thing. Let's take the first, learning disabilities. Learning disabilities, when you're talking to people in family settings, they need to understand what his strengths are as well as his limitations. So you really need to sit down with people and get that across. Essentially, people who have learning disabilities don't want to be treated in an overcaring way. They want to be as normal as possible. In fact, when my son is with his other friends, it's like all hell broke loose. So they just keep talking and talking and talking because they're very accepting of one another. If family members are not that accepting, or they tend to be critical, then you really have to sit down with them individually, share with them that could really be harmful, that they'd better say as little as possible and just try to accept the person for what he is. Now, if you're dealing with more serious mental problems, then it's a question of how can the young person, thrive in this kind of family situation. And it's hard to answer that question without knowing specifics about the family. But in my experience, when those sort of things happen, they're better off having one-on-one small situations rather than big family situations that they have to cope with. Okay.
Okay, so We have another question. What is the most effective way to get family members to take my illness seriously?
Well, if they're not taking your illness seriously, then they don't understand the nature of myotonic dystrophy. And I do a number of things. Now, the first thing I do is give them some things to read, which you probably have done. And I'd outline some of those situations. I'd talk about how it is, those situations, how I experience them, how they are very difficult for me. For example, my son has a difficult time turning on his car key. Now they're making, fortunately, these things where you don't have to turn the car on, but he still has a key in his car. And those little things really add up. So, you really have to be very specific about your disease and what kinds of things you face so that your family can do a reality check about you. And you have to do it without showing that you're complaining or disappointed in them. You have to do it from the vantage point of, hey, this is me. This is how I lead my life. And they're going to want to know, what do you expect from us? And the answer is support, emotional support, understanding, being there when you need them. They don't have to do anything else but provide that kind of support. Okay, I hope that's helpful. Next question.
What if you have done all of that, what you just discussed, and they are still in denial about the disease?
Well, denial is another whole matter. If they're into denial about the disease, you're going to have to accept it, because there are people who literally cannot do it. I mean, they cannot be caregivers. There have been divorces over this. They're just not emotionally ready to do this. You essentially have to accept them and go on with your life. Denial is one of the most difficult things to work on, even in a therapeutic relationship with somebody who wants help but denies things about themselves. But family members who deny things about MMD, and some of them actually may have even been the cause of the MMDs in a genetic relationship, it's very sad. But you have to take care of yourself first. And don't ever forget that. If you don't have support from your family, get support from MMD support groups. Get support from MMD conferences. Get support from even the Warm Line, which is a new service available to MDF, in which you can call in your questions like these, and they can be answered. And if necessary, they can be referred to an expert to answer them. But anyway, don't just stand there. I mean, just get the support where you can.
Okay, we have let's see, a couple more questions, and we have about 10 minutes. So somebody is writing, my daughter's mother-in-law asks me every time why my daughter is not pregnant yet. What do I say to her?
Well, you really need to know more than that. I mean, if your daughter, if this person who's asking knows the daughter has MMD, that's one thing, because getting pregnant is not a good idea, because you could pass on the disease to the newborn. And if this is a person that you really can confide in them and trust and really feel they need an answer, you really have to sit down with them and explain that this is a genetic condition and needs to be handled very sensitively in terms of having children or adopting children.
So did you want to say a few words about, you talked about Wormline. How about the conference? Did you?
Well, I mean, I've been attending these conferences for, well, I attended the MDA conferences and now the family conferences with MDF. They are an incredible place to meet other people who have questions similar to yours, to join a community of people spread across the entire country, and in some cases even outside our country, who are incredible support for you. Knowing them and knowing they exist and keeping in touch with them could be an incredible way to gather support. My son is a member of a young adult group that has met every year. I think he's done it for 7 or 8 years out there, and at the conferences, and goes every year and won't miss any one of them. And actually now goes to a informal meeting held once a year in California where a lot of young adults get together just to chat. And I've observed those meetings, and I can tell you, when the young adults get together informally, without a facilitator, without any expert, to just have a good time, and they do, 24 hours a day for about 2 or 3 days, and then they go home and they stay in touch with each other, and then the next year they have another informal meeting. And so it happens in the LA area once a year, and I get a kick out of it just watching them. So people need one another. That's essentially the bottom line message. I mean, people need one another. They need family members. They need employees. People need to be connected, and people with disabilities in particular need as much support as they can get.
Well, thank you so much, Barry. We really appreciated your presentation, and we'll look forward to seeing you at the conference in Houston.
Okay. Well, thanks very much.
I just want to tell you all about our next webinar. It's next week, Thursday, October 3rd, and that's 2:30 p.m. Pacific time, 5:30 East Coast time, and the title is Treatment Options for Pain. You can register for this webinar at this address on the screen. You have to register for each individual webinar. So if you attended this, it doesn't automatically mean that you will be registered for the next webinar. As Dr. Cohen mentioned, we have a Wormline, and you fill out a form online on the MDF website. And then I will contact you, and we have other Wormline volunteers, which Dr. Cohen is one of the volunteers. So you may have a chance to speak with him about, you know, some issue that you have. And I want to thank you all for your participation. Thank you very much.